When I think about drugs that I use commonly as a neurologist, I think about anti-seizure medications. They're the number one drug that I use. And when I think about those drugs, I think about how effective they are, I think about how safe they are, and I think about how easy they are to administer. When you have an anti-seizure medication, you're going to be giving it every single day, multiple times a day sometimes, for the rest of that dog's life. So they make them uniquely important medications that are easy for the client. And so I think that if we can ease the lives of our clients and even make nominal improvements, but improvements that make it better for both the patient and the client, then they're worth being interested in. If you think about it, human medicine, most of us walking around the world have never had a surgery done on us before. And yet every single dog that we meet has had a surgery at some point, whether it was a spay or it was a neuter. That's kind of a funny thing if you think about it. And yet, despite the fact that animals have had multitudes, more surgeries than humans, the frequency with which we've looked at wound care and improving wound care is actually somewhat minimal. And so I was very excited about a new product on the market that could improve the degree and safety of wound healing. About safety, and I think about efficacy. That naturally comes to mind. Um, and so if I'm going to use a product as a gold standard, I want to know that the risk level compared to the current gold standard is lower, and I want to know that the outcomes are going to be superior to the gold standard. And it doesn't have to be a big jump, but it has to be something that is an improvement nonetheless.